Good morning, folks. This is a convening of the Central District Board of Health meeting for Friday, December 18th, 2020. It is 8:30 in the morning, and I am the presiding chair for the meeting from Elmore County. I'm Betty Ann Nettleton, and at this point, I will go ahead and call the meeting to order. I will announce after item number 6, after Natalie and Gina's presentation, we will be taking a 10-minute break. So with that, we will proceed with roll call for Boise County. Ryan, are you there? You're Ryan. Valley County?
Commissioner Hasbrook here.
Thank you, Elt. Ada County?
Jane Young here.
Thank you. Dr. Epperly here. Okay, thank you, Diana. Elmore County?
Representative Blanksma.
Okay, thank you, Megan. Okay, proceeding on with action items. Russ, do we have any changes to the agenda?
Madam Chair, no changes to the agenda today.
Okay, thank you. We've got a lot to cover today, so we will be approving minutes from 4 previous board meetings, and I will start with the December 1st, 2020 board meeting. And
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
I would move that we approve the minutes from December 1st, 2020, December 4, 2020, December 8, 2020, and December 15, 2020.
Thank you, Megan.
Diana, second.
Okay. Is there any further discussion before I call for a vote? Hearing none, I will call for a vote on those 4 board meetings, starting with Boise County. Right, it's Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Commissioner
Laciando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. Those minutes stand approved as presented. Proceeding on with number 5 on our agenda, with financial reports by Laurel and Support Services Division Administrator. And Russ, I want you to welcome Laurel before we get into the report, okay?
Yeah, sure, Betty Ann. So Laurel joined us about, I guess, 3 or so weeks ago, and she is Bonnie Spencer's replacement. So she's our new division administrator. And prior to joining our agency, she worked for about 10 years with the Department of Labor, and she has a bachelor's and master's degree from Boise State University. And being that she is new, I hope you guys will take it easy on her today with questions, and I know she'll do her best to answer those, but this is our first board meeting and first budget presentation to all of you. So I'll turn it over to Laurel, and she may have some other things she would like to share about herself before she starts talking about numbers.
Thank you. Thank you for the introduction. Thank you, Madam Chair. Russ gave a good summary. I was at the Department of Labor for just over 10 years. Have background in management of both staff and grants and programs and process and program improvements. So really excited to be here at Central District Health, and I've had a really warm welcome so far, and I know it's a bit of a contentious time to be joining, but I'm really glad to be a part of the team and be able to work with you and present to you. So as I go through the budget update today, please do keep in mind that I've made some good notes. I've referred back to Bonnie's notes, but some of the specific questions I may need to get back to you on the details. And I do have some support on the call as well. So if we can answer them here, we will. And if not, we'll get back to you with anything that we need. And so I am ready to go into the budget report. Thank you for pulling that up, Dustin. And you should have this in your handout as well. So we'll just start with page 1. And this report goes through November 30th. So that's about 46% of the fiscal year. And the overall summary is that our revenues are high at 57% of what had been planned, and expenditures are right on target at 46%. So right where we want to be there. Revenues and expenditures do continue to be impacted by COVID, as we expect. And you can see that in contracts under revenues, and then you can also see some variance from what the plan was under expenditures. And that's where you see that how the COVID funds have impacted us and our personnel adaptations. Getting into a little bit more of the details, if we're looking at the revenues, for other revenue under support services, we'll just start at the top of the line. The numbers there are a little higher than planned. That was due to some rebates that we got and some auction revenue and an auto sale. Moving down to community environmental health, fees are high due to annual food inspection permit renewals coming at this time of year. Our contracts are high due to COVID funding. That's where you see that impact. And then other funding is high due to some payments from the WICHC, I'm learning the acronyms, which is the Western Idaho Community Health Collaborative. Moving down to the next line, family and clinic services. Fees and contracts are pretty close to the planned amount. There's a little bit of variance there. Other revenue is high, and that is a change from last quarter's report because the state home visitation funding have been included there. And then our total revenue is right on target for where we want to be. And then again, just looking at total funding, we are at 57%, even though only 46% of the year has elapsed. So higher than where we had anticipated being. Moving on to expenditures for administration, personnel and operating is lower than planned because we've been able to charge to some of the COVID funds, and you'll see the same thing there for support services, lower than planned due to charging to the COVID response. Capital is high, you'll see that at 252% because of a project payment that was carried over from the last fiscal year, and that's been consistent from last quarter's report as well. For community and environmental health, personnel and operating are higher than planned because of additional staff resources, again, related to COVID. That seems to be the underlying theme to a lot of the changes in these numbers. And then for family and clinic services, personnel and operating are a little bit lower than planned because we haven't been able to operate the same due to our COVID response. And there have been some changes in that as well. And moving on to page 2 now, Dustin.
Madam Chair, this is Representative Blanksmith.
Yes, go ahead, Megan.
I just had a quick question about the home visitation funding and the state plan amendment, and if Russ had any additional information on how that was going through the Department of Health and Welfare.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, that's a great question, Representative Blanksmith. So we did just get notifications that that we would be able to start billing under the state plan amendment for home visitation for Medicaid families, and that we would be allowed to back bill to the start of the year. And I know that was the intent of the legislature. The state general fund was cut to the public health districts in anticipation of being able to bill Medicaid and generate revenue through that mechanism. So we're just getting everything in place right now to make that happen. We have one employee who has been charging against I call it a reduced state general fund allocation, but it was reduced because we anticipated we would need some time to allow the Medicaid state plan amendment to go into place, which in fact was the case. So we'll work on some back billing options for her, and then be able to expand services out into our other communities, because the federal money we have been receiving has been restricted to only serve Ada County. So I think we're in a good place right now, and looking forward to expanding services to our rural communities over the next year.
Madam Chair.
Yes,
Diana.
speaking, please. Yes, Diana, go ahead.
This is less a question, more of a clarification. Since I know, we have a lot of people who are watching and interested in what we're doing always. And there's some concerns floating out there about whether it's hospitals or perhaps even other entities like the health district making money off of COVID. And I think it would be important, just for the record, for you all to clarify what the additional revenues have been directed toward, whether it's contact tracing or the call center, et cetera. Russ, if you just want to clarify that, I think that's important.
Madam Chair, Russ?
Yes, Russ, go ahead.
Yeah, so with the additional revenue, the additional funding we're receiving, it's basically we bill against our expenses. So to your point, Commissioner Lasciando, we've added numerous staff. I don't know exactly what the number is, but for example, with contact tracing and disease investigation, our team normally would be around 4 or 5 staff, and now we have close to 40 staff doing that. So it's added cost. There's no money going into some bank account or a reserve fund. We're incurring those expenses, and then we bill against the federal dollars that are coming in.
Thank you.
Madam Chair, this is Al.
Yes, El, go ahead.
So Russ, does that reimbursement include all your employee costs, you know, your insurance and FICA and all that, everything completely?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yes, we anticipate that the reimbursement we will get for the expenses we incur will cover 100% of all the costs. So personnel, including the benefits that you mentioned, as well as any operating or capital expenditures.
Okay, thank you.
Madam
Laura,
Chair.
this is Betty Ann. Oh, I'm sorry, El, go ahead. Go ahead.
Sorry, I had a follow-up. Russ, do you have any idea how long these extra staff are going to be on?
Madam Chair.
Yes, Russ, go ahead.
Commissioner Hasbrook, we anticipate having the additional staff well into the spring. You know, a lot's going to depend on how this response unfolds. So if we increase immunity through where we're shifting right now, and you're going to hear about that a little bit later in the agenda from our Public Health Preparedness Program Manager, Natalie Bodine, and Clinic Manager, or Medical Clinic Manager, Gina Pinnell. So essentially, a lot of the resources have been used on the disease investigation and contact tracing side, and that hopefully will start to shift to the vaccine management, vaccine distribution, and we'll be able to, and again, that'll depend on the cases. If we see a decline that we expect to happen, again, as we develop more natural immunity from the cases we've seen, which are quite a lot, as well as the vaccine-induced immunity. So I can't tell you, Commissioner Hasbrook, exactly, you know, how that's going to play out, but I would expect we'll need less federal money later in the spring or early summer.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Thank you. So I don't know that this is the appropriate point in the agenda to discuss this, but Russ, you know, we're all aware, and now there's a statesman story out about how far behind we are in contact tracing. Is there a point at which in this agenda you plan to discuss that?
Madam Chair?
Yes, Russ, go ahead.
That was not on the agenda for today, so if the chair and the board would like me to talk about that right now, I can.
Go ahead, Russ.
Yeah, so with contact tracing, what we had geared up to be able to respond to was a level of disease in the community that we thought would severely impact the hospitals. And as this has played out, due to the types of treatments that are available and the work, you know, as far as on the healthcare side, the hospitals, as you heard from the health system leaders a couple of weeks ago, they are being significantly impacted, but they're able to manage. So essentially what has happened is then we ended up with a lot more cases than we anticipated. And with each one of those cases, you have multiple contacts. So the staff resources we have, we have a very large team here, as I mentioned, but we were not able to keep up with contact tracing on every single case. So what we did was we prioritized who we would follow up with as far as the isolation. That's somebody who is actually a positive or probable, and then their contact. So we look at long-term care facilities, healthcare workers, schools, child cares, and focusing on them. The other thing that was noted is the backlog of cases. So we do have a lot of support here, including members of the National Guard that are helping us with data entry, and we're quickly getting caught up on that as well.
Okay, thank you, Russ. Laurel, this is Betty Ann. Going back to page 1 under Family and Clinic Services, where that is off so much, is it 48%? Is that a billing cycle thing or just a COVID response thing?
So you said under Family and Clinic Services for revenues and contracts?
Yeah. Mm-hmm.
I am not sure if that's a billing cycle thing, but I would be happy to either get back to you on that, or I believe Chris Spain is on the call as well. And if you might defer the question to her, she might be able to answer better than I can.
Okay. Christine, are you there?
Madam Chair, this is Chris.
Oh, hi, Chris. Do you have any explanation for that discrepancy with our Family and Clinic Services under contracts being so down so much?
You mean being 53%?
Mm-hmm. Well, 48%.
Yeah, I believe our total is 48% of total revenue in Family and Clinic Services, which feels like we're halfway through the year. So I'm pretty sure it's due to timing of some of our contracts coming in. In Family and Clinic Services, we get them throughout the year. Fiscal year, federal year, April, January. So that would be what I suspect is it. And I can explore that a little more and get back to you.
Okay. Thank you, Chris. Okay, Laurel, the floor is yours once again.
Okay, thanks. And thank you, Chris, for being put on the spot and answering that. And just as a reminder that Chris is right, we are 46% through the year at the time that these numbers were completed through. So being at 48% is just slightly ahead of where we would anticipate to be at this point in the year.
Okay, thank you. Where we should be then. Okay.
Yes, exactly. Okay, moving on back to page 2. So this is a comparison of the past couple of years compared to this year. And as you can see, I don't have a lot of details to go over on this page, but our fees are up in both community and environmental health and Family and Clinic Services as our programs continue to expand. And Bonnie had a note in last quarter's presentation that you can see the fees in Family and Clinic Services have gone up quite a bit. And that was because under the advice of our medical director, we had changed some of our billing codes to reflect more accurately the work that was being done. So that trend should continue. And then as the growth continues in both CDH and Family and Clinic Services, we expect to see continued growth there. We've also improved some of the collections of our old account balances, and that's reflected in the Family and Clinic Services increase as well. And that's all the notes that I had to go over for page 2. So are there any other questions before moving on to page 3?
Madam Chair, this is El.
Yes, El, go ahead.
Laurel, I just had a question. One of my children's works at the local hospital here, in billing and accounts, and according to her, Medicaid comes out with new rates on a quarterly basis. And are we updated on those new rates?
I am not sure about that either. So I can find out, and I'm not sure how frequently we update our rates based on Medicaid rate changes, but I will talk with Chris after the call and can get back to you on that.
Okay, you can just send me something off the side.
Okay.
Thank you.
Thank you.
Madam Chair, I can answer that though. It's Russ.
Yes, Russ, go ahead.
Yeah, Commissioner Hasbrook. So no secret to anyone that Medicaid payments are generally considerably less than what the private sector pays. So we set our fees, which you all approve, based on the reasonable and customary fees we'd expect to get from the private sector. So even if Medicaid adjusts their rates throughout the year, it's always still far less than what our billed rate is. So there's never a gap like where we're not collecting the maximum revenue we can from Medicaid when we provide services to individuals in our community who have Medicaid as their insurance. Does that make sense?
Makes sense, Russ. Just to follow up, so then do you guys track the difference between what you actually charge and what you get paid from Medicare? I mean, can we use that as, you know, unearned income or something like that? Just because that would be some good information to know if we ever wanted to go to the legislature and ask for more money, show them that, you know, at the Medicaid rate, this is what we make it. Private rates, we would have made this much, and I bet it's a huge difference.
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yes, Commissioner Hashbrook, we would have that data. We could provide you, you know, essentially summaries, and if the board's interested, we could do that periodically in this in the budget to actual report or some other separate agenda item. But the difference is significant between what our costs are to deliver services and what Medicaid reimburses. And as everyone knows on the board as well, is we have a sliding fee scale. So we do slide our fees all the way to zero for most of our clinical services. So that's another loss in revenue. And the state legislature already provides funding to the public health districts, as do the counties. And we do use that money to make up those differences between what we're able to generate through fees, either individual, you know, private pay, people pay for services, or through insurance reimbursement, whether it's Medicaid or private insurance.
Thanks, Russ.
Okay, thank you. Laurel, go ahead with your financial.
Thank you, Madam Chair. We'll move on to page 3 now. Page 3 is the November cash balance statement. So as you can see, our total cash balance shows a balance of about $3.5 million. Reducing it by the reserve fund designation leaves a balance of just over $1 million. And this is another area where I referred to Bonnie's notes to provide the update for today. So at the last budget review, it was at 1.6 million. And as Bonnie's notes indicated, her expectation was that it would continue to dwindle down over the next few months until we receive the second half of our state appropriation in January. So based on her notes, and then I looked at a couple of past years, and that decrease appears to be the normal course of the cash balance at this time of the year. So any questions on that before moving on to page 4? Okay, then we'll go ahead and move on to page 4. And this actually looks exactly the same as it did at the last budget to actual update, with the exception that we've changed the dates of when it was current through. And the only real note I have to go over here is that the Boise office FCS reception lighting revision has been completed. We have not received the invoice for that yet, but we're expecting to get it anytime, and that did occur as planned and as budgeted. So just waiting for the final invoice to come through on that. And then the completion of the new carpet, paint, and furniture is still in the works, but there's some dependencies on having new staff use different areas of the building, and just having our building at more capacity than we generally would. So the few dependencies on that before we can complete the new carpet, paint, and furniture project as planned. So any questions on page 4?
No.
Okay. Thank you, Madam Chair. That concludes my budget report.
Okay, well, thank you so much, Laurel. Okay, proceeding on, we will have Natalie and Gina present their vaccine planning presentation. So welcome, ladies. The floor is yours.
Hey, Betty Ann, it's Russ.
Yes, Russ.
Yeah, I just, before Natalie and Gina go into their presentation, I just wanted to make it very clear to you all and to the public as we're entering the vaccine phase of our response. And again, we're not not disengaging all the other work that we have to do with the disease investigations and contact tracing and what have you. But there is no government agency in the state of Idaho that is going to mandate or require that anybody get this vaccine. So I think that's a really important point. I know there's a lot of chatter out there about requiring vaccines for certain populations. And that is simply not the case, nor it will be the case. So I'll go ahead and turn this back over to Natalie and Gina for their presentation.
Thank you, Madam Chair and Russ. And thank you to the board for just a few minutes of your time this morning to give you an overview on vaccine distribution planning for Central District Health and some of the efforts and activities that are coming fast and furious over the last week and moving forward. Next slide. Thank you, Dustin. So 3 points that we're really holding true to for Central District Health when we're looking at vaccine planning and distribution is that we will be following the Advisory Committee on Immunization Practice, which is the ACIP, and the Idaho COVID Vaccine Advisory Committee, the CVAC guidance. So that's the governor's committee. So we will always be holding true to those guidance when it looks at priority populations and allocations, which is going to be important as the vaccine is rolled out into our state and there are limited doses in these first few weeks. We will also be partnering with and supporting our healthcare providers out in our jurisdiction who have that current capability to receive, store, and administer the vaccine. So very important for us at Central District Health, and maybe a bit different than you've probably heard from some of the other public health district plans out there. But we, given our locality and the number of healthcare providers in our area, we really want to partner and support with those healthcare providers that have that current capability. And then also working with and encouraging our healthcare providers across our jurisdiction to sign up through the Idaho Immunization Program to become a COVID vaccine provider. So in order to receive vaccine and administer vaccine, healthcare providers have to be signed up through Idaho Immunization Program. So they have taken the lead on that, but we are certainly supporting that and talking with our providers and assisting in any way we can to make sure that they know what that process is and helping them get through it. Next slide, please. So diving a little bit deeper into the ACIP and the CVAC recommendations that we will be following for vaccine allocation for our priority populations, here is a kind of a general overview of the 4 phases of allocation to priority populations. And again, we are, of course, just started and are focusing in on phase 1, which is our healthcare personnel. And I'm going to break this down just a little bit more in phase 1. So phase 1 is going to include hospital and clinic staff essential for the care of COVID-19 patients and maintaining that hospital capacity. It'll include long-term care staff and residents, emergency medical services, and then we'll get into outpatient and inpatient medical staff that are not already included in that first phase who are unable to telework. And so, for example, these will be a lot of our outpatient clinics, including our school nurses. And then we'll move to dentists, dental hygienists, and dental assistants, pharmacists, pharmacy technicians, pharmacy aides, and then public health and emergency management response workers who are also unable to work. So some of those other essential workers out in our community. So wanted to break phase 1 down a little bit more. Again, as we are beginning to receive vaccine into the state, we are getting a very limited supply of our first shipments. So sub-prioritization through phase 1 is going to need to be happening. So we will work our way through phase 1 as we continue to get more vaccine into the state. Next slide, please.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Natalie, we're seeing that we're getting considerably less vaccine than was initially promised. What's driving that? Do you have any sense of that at this point?
Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yeah, Commissioner Lasciando, I'm sure everyone has seen on the news that it looks like our second week allocation of Pfizer vaccine has been reduced dramatically. I do not know what is driving that. My initial thought was that there may be a holdback of some Pfizer vaccine to activate the National Pharmacy Partnership Program, but that doesn't look to be the case. So I do know that we have a district-wide call with the Idaho Immunization Program today at 10. So certainly hoping that they will be diving into that and explaining a little bit about what's going on. But that's what I know so far.
Thank you.
So on this slide, as I talked to before, we are going to be partnering with and supporting healthcare providers across our jurisdiction that have that current capability and have enrolled through the Idaho Immunization Program. So here is a list, and this list grows every day as we're working with our partners. But these are our current enrolled partners that have signed up and that will be hopefully receiving vaccine if they haven't already. And of course, our St. Alphonsus Health System, St. Luke's Health System. And one big error on my part for this slide is I did not have Primary Health Medical Group on this slide, but they are an enrolled provider as well. Cascade Medical Center, FMRI, Terry Riley, our Albertson Save-On Pharmacies, Intermountain Hospital, Seltzer Health, Vibra Hospital, and Desert Sage Health Center. And I just looked this morning to see if we had any new providers that had enrolled, and we have Ada County Paramedics, Meridian Family Medicine, Treasure Valley Hospital, and then 2 Ridley's Pharmacy locations, 1 in Star and 1 in Cunis. So again, we are continuing to support our providers and get in signing up and working their way through this process. So I will say that St. Alphonsus Health System, St. Luke's Health System, and Primary Health Medical Group were our 3 main providers to receive the first doses of Pfizer vaccine that arrived this week. Next slide, please. So 2 programs I wanted to talk about for our long-term care facilities. So our long-term care facility staff and residents are very high up in that phase 1, just behind the hospital and clinic staff, essential for the care of COVID-19 patients. We have a large number of long-term care facilities that have been dealing with active outbreaks throughout this whole pandemic. So 2 programs that are out there for the long-term care facilities. The first one is the National Pharmacy Partnership Program. So this is a federal partnership with CVS and Walgreens. Focuses on residents, but they will vaccinate staff as well. Staff have not already been vaccinated. And the majority of our long-term care facilities in our jurisdiction have signed up with this National Pharmacy Partnership Program. And if enough vaccine is into the state, this program has been activated. We just need to wait until we have enough vaccine, but they are estimating that they will begin vaccinating this group at the end of December. So really good news there. And then also all of our skilled nursing facilities in our jurisdiction have signed up with this program. So this will provide on-site vaccination services to these long-term care facilities that have signed up. So not all facilities have signed up though, and we are working our way through a list. We do know for whatever reason, we probably have about 20 to 25 facilities that don't look like they've signed up, and we certainly don't want them to fall through the cracks. So we are reaching out to them to make sure that they are connected with another provider. whether that be a hospital affiliate that they're already working with, some other healthcare provider, and maybe a local pharmacy as well. So we will be working with those that are not signed up to make sure that they have access to the vaccine. Next slide, please. So the other program
Natalie,
I wanted to...
Natalie, can I just ask a question? This is Ted Epperly.
Yes, please go ahead.
Thank you, Betty Ann. For the prisons and jails, as a large congregate living center, I assume that in phase one, there would also be some rollout to those institutions, or are they being prioritized to a later phase?
Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yes, Dr. Epperly. So we are working, so they're in both phases. So we are actually working with the Ada County Sheriff's Office as they have a number of beds available and have a number of frontline healthcare personnel that work in their jail. So those frontline healthcare personnel are part of phase one and will be receiving the vaccine as soon as we have enough in the state and can get it to them. Residents and inmates, the population in the correctional facilities, that will come in phase two, and they are actually a little bit higher up in phase two. So it'll be a bit of a rollout, but we will be working to get the frontline healthcare people vaccinated first.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So Natalie, this is maybe an appropriate time to bring this up, and I'm just going to keep bringing it up in every venue because I don't hear an answer anywhere. Often overlooked, and in this case as well, is where do coroner's office and coroner staff fit in with all of this? And for us, our coroner's office, they're handling decedents with COVID. They were taking all the proper precautions, but we have really struggled keeping staffing up in our coroner's office, and they're already a really slim staff. We've had to have staff come over all the way from Teton County to bolster our coroner's office. And this isn't just for me an Ada County issue. This is, we're providing the forensic pathology for over 30 counties, including all of those in this health district, but many others in Southern Idaho. So I'm not on the committee, I don't know, but I don't hear where they have been prioritized. Given the work that they do and just how critical they are to our infrastructure, I would put them up there with medical personnel, at least with the emergency medical system responders. It's a small staff. So if you can track that down and help us figure that out, because we just have not, I'm just checking with our coroner right now. We have not gotten any response about when they may be eligible in this.
Yes, Commissioner Lasciando, I have written down that note, and given the opportunity, I will ask that on the 10 a.m. call and follow up as well.
Thank you.
Madam Chair, this is Zelt.
Yes, Zelt, go ahead.
Natalie, it looks like you guys have really done a great job aligning some of this up. I too agree with Commissioner Lasciando on the coroner. Our coroner was out for a couple of weeks with the COVID, and so it's been kind of tough up here. But my main question is, there's a lot of elderly folks that aren't in long-term care that are out here in rural America. How are they going to be prioritized? Because to me, it seems like they should move up the ladder. Those super elderly, I guess we'll call it, to be able to get this pretty quick.
Yeah, Commissioner Hasbrook, so I would see, and I didn't expand a little bit, so they do fall within phase one as I am looking at the priority populations pushed down by CVAC. So they are part of that long-term care facility staff and home care providers for adults age 65 years and other adults with high-risk medical conditions. So They are on our radar. We will be working out and making those connections to those healthcare providers in those communities to make sure that we don't miss anybody. But I am always open to emails or phone calls. You know, if you have a list of facilities that you want to make sure that get on our radar, please send those to me. I'd be happy to chase those down. Okay, so moving on to the slide that we're seeing now. So the second federal program that has been developed for long-term care facilities is the Federal Retail Partnership Program. So this is a program with the U.S. Department of Health and Human Services and CDC, partnership with our retail pharmacies. So the idea here is that 90% of the public lives within 5 miles of a retail pharmacy. So the focus of this program is the public, and pharmacies will receive direct allocation of vaccine to administer to the general public. And partners in this program include Walgreens and CVS, Rite Aid, Walmart, Costco, Albertsons, and the Kroger companies, which is our Fred Meyer parent company. Again, no timeline as far as when this program will kick into gear. Everything is really dependent on how much vaccine is delivered into the state to get some of these started. Next slide, please. So just a quick slide on the vaccine, the 2 different vaccines that we are working with and planning for the delivery soon. So the Pfizer vaccine, and like I mentioned before, our St. Al's Health System, St. Luke's Health System, and Primary Health Medical Group, all this week has received doses of the Pfizer vaccine. So this was approved by the FDA for EAU status on December 11th. This is a vaccine that requires that ultra cold storage control and has very specific guidelines to follow when receiving, storing, and distributing this vaccine. Again, not all healthcare providers have current capability to receive and store this particular vaccine. The minimum dose order for this is also 975 doses, which is 1 tray of vaccine, and a maximum order is 5 trays, which is 4,875 doses. So pretty large numbers for ordering. It is a 2-dose series. And again, like I said, for Central District Health jurisdiction, the first shipment of Pfizer vaccine, we received a total of 5 trays. So 4,875 doses is all for our whole jurisdiction to get started with the first administration of vaccine. So that is happening. St. Alphonsus and St. Luke's received their trays throughout the week, and I just heard from Primary Health Medical Group. They received the 1 tray of vaccine yesterday morning, so they'll begin vaccinating. The other vaccine that we are closely following and is in review by the FDA now for EAU status is Moderna. That is expected to be approved as early as today. This vaccine is much easier to handle and store. It is shipped and stored at freezer temperatures until ready for use, and then can be stored in the refrigerator for up to 30 days. Which I don't have this on the slide, but Pfizer, once the Pfizer vaccine is thawed, you have up to, oh my gosh, I'm blanking.
30.
Yes. So the Pfizer vaccine, you have to get in arms a whole lot quicker when it's been thawed out, the Moderna vaccine. So Moderna provides for a little bit more flexibility and ease of transport if needed.
Natalie, yeah, it's 6 hours for Pfizer. Once you constitute the vaccine, 6 hours.
And I believe before Constitution, in the refrigerator, it can be stored for only up to 5 days.
Yeah, I think that's correct as well.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So to that end, Natalie, I would assume that then the Moderna vaccine is going to be prioritized for getting to Elt's point to our more rural locations because it requires less, careful storage. Is that where things are heading?
Yes, Commissioner Lasciando. So we'll definitely be able to get this out to more of our healthcare providers that are signed up. It's easier to store and manage and much easier to transport for redistribution. So this one will be pushed out far and wide into the following phases. So a lot of our long-term care staff that have not signed up with CVS and Walgreens will be first priority to receive the Moderna vaccine. And then we'll move through the line down through EMS and then our outpatient medical staff as well. A couple other points on Moderna is that much smaller dose ordering, which again makes it easier to store and manage. Minimum order for Moderna is only 100 doses. And the Idaho immunization program will also direct ship to the location. So it will not be stopping anywhere else. It'll be direct shipped to the location that's going to vaccinate. And I have at the bottom here that we have an unconfirmed allocation for our Central District Health jurisdiction of 9,600 doses. So that is what we're planning for. I always leave it unconfirmed until we know exactly what's been shipped because things change quickly. So again, not a lot of doses, but again, we'll just continue to kind of baby step our way, working with providers and working through this first phase 1 of priority populations. Next slide, please. And that is it for my presentation, and I will stand for any questions and also want to Gina Pinnell, who is one of our program managers with Family and Clinic Services, is also on the line as well to answer any questions if needed.
Madam Chair.
Okay, thank you, Natalie. The floor is open to questions for Natalie or Gina.
Madam Chair, this is Ted Epperly.
Go ahead, Ted.
Go ahead, Ted.
Thank you. Oh, okay, thank you, Betty Ann, thank you. First, I want to echo Commissioner Hasbrook's comments earlier to you. Thank you, guys. I know a lot of work went into this and appreciate your thoughtfulness of trying to get this rule out clear. It's going to be a logistical challenge, there's no question. Natalie, one thing you didn't comment on, I think it'd be good for us to understand and the public that might be listening, is just the side effect profile on both the Pfizer and Moderna vaccine, just for the general interest of the public. Let me tell you what I think I've read and heard, and then let you add to that. Both vaccines, extremely safe, extremely effective at the 94, 95% level. Side effects at about 3 to 10%, roughly, common being headache, fatigue, joint aches, muscle aches. My understanding is the Moderna vaccine has about twofold the increase in side effects, but still small, 3 to 10% range versus the Pfizer. Just want to make sure the public knows that you cannot get COVID-19 from this vaccine. This is not a live attenuated virus in any way. It specifically codes for the spike protein, so people won't get it. And one other point that I'd just stress is that people that have had COVID-19, they need to get the vaccine still, unless they have an active case ongoing. So, Natalie, just perhaps your thoughts, comments to those statements, and anything you would add in terms of an educational piece for the public, and will there be an educational one-page piece that they could see at Central District Health's website so that they could see some of the educational points?
Yes, Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yeah, Dr. Epperly, thanks for bringing that up. We have been in contact with our providers that have started vaccinating, and I've asked that question, you know, what kind of side effects are you seeing with your staff so far? And really small amounts, maybe a little bit of a sore arm and some fatigue, so that's really good news that we're hearing back. And I would say that the systems are also staggering vaccination with internally to allow for that time if there is some potential side effects, that it's not affecting their staffing in their facilities. So they're going through tiers. I know St. Luke's has a 5-tier system to get through those priority populations. So vaccination of this initial group will happen probably over a week or two, and the same with St. Alphonsus as well. One question that Commissioner Lasciando brought up, and I was able to get a little bit more information on when I presented this information to the Ada County Executive Council, was about the mRNA vaccine and the effect, you know, to DNA. So what I was able to find is that the COVID vaccines are mRNA vaccines, but they do not include viral particles or an inactivated virus, and cannot give you COVID, like Dr. Epperly stated, and that the mRNA from the vaccines is quickly degraded, and it does not come in contact or interact with our DNA, so it cannot alter our DNA. And that is just some initial information that I was able to find on that.
So, Madam Chair, this is Diana.
Yes, Diana, go ahead.
I think this is, you know, where I'm hoping to see some kind of maybe more coordinated public awareness messaging coming down from the state about what the vaccine is, disputing myths, et cetera. In absence of that, we're going to have to do it ourselves. But I just don't, have you heard, are they developing a messaging campaign? I just don't know.
Yes, Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yeah, so to Commissioner Lasciando's question, I do know that Christine Myron, who is our public information officer, is connected with the state, and from what she has said, they are planning to do some comprehensive statewide messaging. I don't know what that is exactly going to look like. Christine would be the best, and I can follow up with her to get information. But I also wanted to mention that on our CDH webpage, we do now have a section on vaccines. So we are posting all information that we have on the vaccine. And Moderna, the official information on Moderna will come after the EAU has been approved. So we are putting all of that information on our webpage that's accessible to all, and providing FAQs within our emergency call center as public calls in with questions.
Madam Chair, this is El.
Yes, El, go ahead.
You know, this is what we've been waiting for, is for this vaccine to come out. This is giant news as far as I'm concerned. Natalie, my question to you is kind of a 3-part. I know a lot of folks are concerned about the ingredients in the vaccine. In the old days, it was mercury and some of the carrier. Maybe part of that would be on your website of, you know, does it have egg in it? I know a lot of people are allergic to egg, and so people are totally secure in the knowledge that they received to get this vaccine. My second question and point, I guess more so, is the fact that, you know, we've been kicked around pretty hard the last few weeks with the vote and all this kind of stuff, and I think this would be a good PR thing for the health district for us to go and push it out and PR it and let people know that, hey, we're doing a good job. We're getting this vaccine out, and I think it'd just be a good PR for the health district to really push this out. I'm excited. I think Cascade's supposed to get the vaccine, I believe, next Friday, if I'm correct. I could be wrong on that, but they do have the refrigerators, and they're all set up and ready to go. So we're going to push it on the county level up here as well. If I can talk the other 2 commissioners into it and get the word out. This is all good news, and I'm really excited. So thank you.
Chair, this is Natalie.
Yes, Natalie, go ahead.
Yeah, and I also wanted to share that there will be a news release that Central District Health will push out later today on the vaccine. So, yes, point very well taken, and definitely a focus of ours on making sure that we have as much information out there as possible on the vaccine. And yes, Cascade Medical Center is coordinating with St. Luke's Health System, and they should be getting vaccines soon, so very exciting.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I just wanted to thank you for all the hard work and sorting through all the details to make this happen. It's huge. And the other question I had was, do we have freezers, or where are we in that process?
Yes, Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yeah, thank you very much for that support and kind words. We definitely have an unbelievable team here at Central District Health, so I'll definitely pass that on to others. The update on the ultra-cold freezers, the Idaho Department of Health and Welfare had purchased 7 freezers to be distributed to each of the 7 health districts. The last I had heard on the freezers is that that is delayed and delivery won't happen until early February. So to be determined on the freezers, but we do have good partnerships across our jurisdiction, and a number of our healthcare providers have the ultra cold freezers.
Thank you.
This is Elt again, sorry.
No, go ahead, Al, that's fine.
Natalie, as part of the campaign on getting this out, are you going to talk about the cost? I don't know if there's a charge or if they're going to be free or how that's going to work, but I think that should be information that is included on the webpage as well, so people know that, you know, they're going to need some money or they're not going to need money.
Madam Chair, this is Natalie.
Yes, Natalie, go ahead.
Yes, definitely will be information on the cost. The vaccine is free of charge, so there is no cost to anyone receiving the vaccine. Healthcare providers can charge an administration fee. So if a person has insurance information will be gathered and the insurance will be charged for that. Again, the person will not have to pay for any of that. And for uninsured, there is some FEMA programs I know that are out there for those healthcare providers if they want to seek reimbursement for those administration fees later down the line through FEMA.
Madam Chair, this is Ted Epperly. One other point, please.
Yes, Ted, go ahead.
Yeah, I think one thing that's going to be important, Natalie, to put into the messaging piece is that, again, this is going to take a while, of course, to roll all of this out. The general public, many won't be immunized probably until the March, April, May timeframe. For us to get to, again, herd immunity, it's going to be 70-75% of the population or so. So one thing that I think is important for the public to know, not only today to those that are listening, but also in our messaging piece, is that masks will need to be continued to be worn probably by the time this all gets said and done, probably into the midsummer timeframe. And the reason is that, again, even at 95% effectiveness in terms of potentially not getting COVID-19, but if one still can get it, it's not like it's, you know, totally protective. What has been demonstrated so far is that the cases are much, much, much milder. The issue there is that it can be so mild that you might be asymptomatic, so that there's still a spreading potentially of COVID-19 in the community. Hence, once the vaccine series is completed, which peak immunity is 2 weeks after the second shot, it's not like people can start taking off their masks. This is going to be something we need to continue to use public health measures, masking, distancing, social group sizes. We still have to be meticulous about this for probably into the early part of the summer. So I think to set expectations now is going to be important. It is not something that all of a sudden we get the vaccines and 2 weeks later you feel like you can just run around without masks. It's an important concept, and it's one that we need to level set with the community with.
Any further questions or discussion for Natalie and Gina?
Madam Chair, this is Elt again.
Yes, El, go ahead.
So to kind of go on with Dr. Epperly's comments, I agree with you 100%, Doc, but isn't there going to come a point when we're going to see the cases, the numbers start dropping drastically? And that's when it's going to be kind of a hard sell with people to keep wearing those masks. We're on the right trail, but eventually there is a light at the end of the tunnel, and I want the public to know that. If you keep doing what you're doing, then we're all going to get through this. So just want to make sure that gets out there.
Madam Chair, this is Ted Epperly. I'd like to comment.
Yes, Ted, go ahead.
Yeah, totally agree, Eld. Absolutely right on. And that's why these case counts per 100,000 per day that we've been tracking become really important. We know the red zone is greater than 20 cases per 100,000 per day. Again, what the WHO has set as that number is about 2 cases per 100,000 per day. And roughly we're at 90 cases per 100,000 per day now. So you're exactly right. The public can watch this, they can track it. It's the case counts per 100,000 per day, which kind of becomes that gold standard number. And you're right, once we start to get that dialed down, then we'll all be joyous about that.
Okay, thank you. Anything else for Natalie and Gina? Well, hearing none, Natalie and Gina, thank you so much for your presentation and the absolutely huge, unimaginable workload that you've put into this, and will continue to do so. So with that being said, I have announced there will be a 10-minute break at this time, and then we will resume our agenda. Thank you. I'm actually watching the clock. Yeah. Yeah, Dustin, are we still connected? I'm not sure if he says it down. I have to call back.
I can hear you, Betty.
Oh, okay, good. Thank you. It was so quiet. It just didn't seem characteristic for us.
Doesn't seem real, that's for sure.
Right. Yeah, exactly.
Do you know where we sign up for the immunization program?
Natalie, I think Natalie has that address, and I don't know that it wasn't. I think it's just in that national pharmacy partnership.
Yeah.
And I don't know if there's a number. It isn't on her presentation, so I'm sure she has it.
Okay. Thank you.
And of course, you see her website and everything on that contact info.
Yes.
Her office and cell number. So good. So
thank you.
Mm-hmm.
Hey, for all the doctors out there.
Oh,
I have a
Ryan
question.
is here, huh? Hi, Ryan.
Yeah, I've been here. I got up a little late. I had an early morning patient.
Oh, okay.
I was reading somewhere where they were saying that for the Pfizer vaccination, if you're allergic to penicillin, to not get it. And so I was curious if that was going to be across the board for all the vaccinations that are currently coming out, or if there's truth to that, because I'm in that category.
Well, when we all get back on the meeting, why don't you bring that question up again? So if Natalie's still on. So.
Yeah, I'll have to do that. Yeah, I had read that they were saying that Pfizer was saying if you are allergic to penicillin, then don't get their vaccine because it's going to make you sick.
This is Dustin.
Okay.
Just so you know, I can't mute the audio going over to YouTube, so everything is still live on YouTube.
Okay. Our 10-minute break is up, Dustin. So can we go? Are we ready to go back on? We're good.
Yes.
Okay. All right. Okay, folks. Let's resume our agenda, and I believe Commissioner Sturm, Natalie, if you're still on or available, or Commissioner Sturm had a question about penicillin allergy and vaccine reactions. So, does anybody have any information on that? I think Natalie had another call. So, Ryan, you have her contact information there. I would certainly contact her after the meeting. So, okay, let's proceed with our agenda. Josie Graham will be doing a call center operations update at this time. So, Josie, the floor is yours.
Thank you, Madam Chair, and good morning. I think there are some slides. I don't know if those are going to populate. Great, thanks. So as you all know, we stood up an emergency call center in late February before we even had any confirmed cases of COVID in Idaho. And, you know, in February and March, I don't think we thought that we would be fielding 100 calls or more a day in December, but here we are. So we have received actually over 18,000 calls into the call center. They don't all end up with a call sheet, in part because a lot of them get forwarded. So they get forwarded to the epidemiology team or to the long-term care task force. So not all of the calls that come into the call center get a call sheet with them. But we have had almost 14,000 call sheets. And today I want to talk a little bit about some of what I think might be topics that our call center deals with that the board and the public might be interested in. So that includes school exposure calls, business complaints, and then of course we have this trending topic of vaccines. So the next slide will show you sort of overall call data since the beginning of this pandemic. And the scales aren't the same on each of these, so that's a little confusing. Sorry about that. But you can see that at the beginning of the pandemic, there was a lot of interest and a lot of calls, but then as the governor put in stay home orders, our call volume decreased quite a bit. So that's that April and May sort of low call volume on the top chart. Then this summer, as the city of Boise put in public health orders, and then Central District Health put in public health orders for Ada County, and as more people were calling to find out where to get tested, how to get tested, quarantine instructions, things like that, our call volume picked up over the summer. And then again, the bottom bar is a different scale, so sorry about that confusion, but the call center has been pretty consistently busy all fall, and the types of calls that they deal with each day or week change. In part because sometimes they get a lot of calls about proposed orders. The last couple weeks, they've had a lot of calls about vaccines. During certain times of the school year, they've had a lot of school exposures calls. So this is just an overall picture of how the call volume has changed over the last 9 months. And we can move to the next slide. So the top 5 reasons that we have had calls include people calling just for general guidance. And so I didn't make a chart, general guidance calls, but general guidance calls include, where do I get tested? How do I get tested? As you all know, our case investigators and contact tracers are currently prioritizing high-risk groups in schools. So our call center actually fields dozens of calls from people wanting to know their quarantine instructions or their isolation instructions, or if they have someone in their home who is isolating, what does that mean for others in their home? So they offer a lot of general guidance to members of the public. Testing is our second most popular reason folks call. School exposures is our third most popular reason, and this week it's actually number 1. A lot of our most recent weeks, school exposure calls have been number 1. And then we get a lot of complaints as well. So school exposure calls is kind of a misnomer. These aren't calls about folks being exposed to COVID at school necessarily. They are calls coming in from usually school nurses and sometimes from other school administrators who have been tasked with this sort of contact tracing role within their school building or school district. So usually school nurses will call the health district and say, hey, Josie was at school on Monday. She developed symptoms on Tuesday, and turns out she's positive. So we're calling to let you know that she was at school within 2 days of developing symptoms. Here are the other 5 students that, were in her pod, for example, and they were close contacts of hers. So our call center operators take the details of the person who's positive, the details of each of the close contacts of that student or staff member, and it populates onto a form that gets sent over to our epidemiology case investigators. So they basically work as a funnel to get information from school administrators to our epi team. So as you can see, the school exposure calls really picked up once in-person instruction started. And these calls include calls about staff members and students. You'll see that the calls went down when school was out, when there was no school in session during the week of Thanksgiving, and then numbers have continued to dip into December, in part because one of our district's largest school districts has moved to completely virtual. Does anybody have any questions yet about calls in general or these schools calls before I move on to some of our other call types? All right, then I'll move on to business complaints. And of course, I'll answer questions later if there are. So I know that the Board of Health members are all aware that the call center does serve as somewhere where folks can call to report non-compliance. So someone might call and say, hey, I went into this place in the city of Boise or in Ada County, for example, because both of those places have mask mandates. And I observed that none of the staff were wearing masks, or, you know, whatever the call is like that. Sometimes we get business complaints about food establishments, and the call center will take the data from those calls, but then we forward that to our environmental health team here, who includes the inspectors that review those restaurants or other food establishments. One of the roles that our call center has played for at least the last 2.5 months is that a call center manager will call those businesses and let them know, hey, we received a complaint from a member of the public that there's, you know, a lack of compliance with a certain public health order, whether it's gathering size or mask mandates or something like that. And it's really just an educational phone call. It's not a citation. There's nothing attached to it, but it's just reminding them that, hey, if you're open to members of the public without invitation, you are subject to the current public health orders. So our call center managers do make those calls to businesses. Are there any questions about business complaints or how we handle them, or should we move to the next slide?
Josie, this is Commissioner Hasbrook. I have a question.
Sure, El.
Go ahead, El.
So when the businesses are called and there's notified that there's a complaint against them, what kind of reactions are you getting from most of the businesses?
Yeah, that's a great question. And so I'm not making most of these phone calls, but I do usually get a situational awareness email when these types of calls are made. And also, you know, we get little snippets from some folks on our PIO team when some businesses react to these calls. So there have been a few businesses that have posted on social media, for example, like, oh, I got my call from CDH that they're watching me. So sort of disdain about these calls. But usually the calls are great and wonderful. I mean, sometimes we'll hear from someone like, hey, it sounds like whoever called to complain must have, you know, caught a random non-compliant employee, because actually all of our employees are very compliant. We're surprised to get this phone call. We'll have a reminder during our huddle tomorrow morning about keeping masks up above the nose, for example. So the overwhelming majority of the calls, the folks that we talk to at those businesses are very responsive and appreciative, and sometimes some of them don't actually realize that the mask mandate applies to them. They don't think it applies, say, in a private business, for example. So the calls, I think, are constructive and productive and usually well received.
Madam Chair,
Yes.
this is Megan. I just had a quick question.
Yeah. Go ahead, Megan.
Josie, would it be safe to assume that the majority of your calls are coming from Ada County?
Madam Chair.
Yes, go ahead, Josie.
Thanks, Representative Blanksma. Yes, so that's a great assumption. And over 80% of the calls that come into the call center do get logged as coming from Ada County. Our second most popular county to receive calls from is actually Canyon County. And that's in part because obviously people who live in Canyon County, some of them work in Ada County or hang out in Ada County, but our third, fourth, and fifth most popular counties to get calls from are Elmore Valley and Boise.
Any further questions or discussions? Josie, does that conclude your presentation, or?
It doesn't. There's one more slide, and then I have a few more things to share with the group.
Okay.
Thank you, Madam Chair. So
go ahead.
You can see here on this slide that we didn't get a lot of calls about vaccines in most of November, but starting in early December, and especially as information about vaccines started to come out in the news, our call center has received, you know, at least a dozen or more calls a day about the vaccine. And I have to say that the presentation that Natalie just gave to all of you, she has shared that information through the call center supervisor in a FAQ document. So what I didn't get to share at the beginning is that our call center operators use a frequently asked question document that's over 30 pages long and is updated every single day by our public information office. And that FAQ document includes really great important information from our epidemiology team and a lot of other great subject matter experts at Central District Health. In addition to that 30-page FAQ document, there is now a separate vaccine FAQ document that's 10 pages long. So as more and more vaccines come into Idaho and people want to know how they get them, where they get them, whether or not their penicillin allergy will be a problem or their egg allergy, for example, those FAQ documents will continue to grow, and our call center will happily respond to those types of calls and questions from the public. So what I did want to share with all of you and with anyone else who listens to this board meeting is that our call center really is a great resource for all types of guidance, but also to log complaints, concerns, questions about all things COVID related. And if you work in public health or if you're on this board, you might be the person in your family or your friend group who gets the text messages or phone calls asking for COVID guidance, but you might not be the subject matter expert. So I would encourage you, if you do get those kinds of phone calls or texts, to direct them to our call center, because they really are a wonderful resource backed up by a lot of subject matter expertise. And the phone number for our Central District Health Call Center is 208-321-2222. And then with that, I'll stand for any questions.
Okay, thank you, Josie. Questions for Josie?
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I just want to thank her for all the information, the timeliness and the detail that you're able to give people that call, as well as our staff. It's been huge.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
This is for Josie and probably Russ as well. I'm really grateful to hear that the majority of those conversations are positive. I know it has been probably really not always well recognized work that you all have been doing. I'm wondering what you're seeing from a staff turnover perspective, given that this is hard work and sometimes very not well appreciated. What does that look like for all of you?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
I don't have the exact turnover percent, but we do have a lot of turnover with our temporary staff, and that's understandable. As you pointed out, it is hard work. They're temporary positions, and a lot of folks will move on to more permanent positions. As far as turnover among our, we call it our core team, those that were with us prior to March 13th, we have had very little turnover. Our staff are incredibly committed to this effort, and so I've been pleased with that, because I know there's a lot of attention, national attention given to the high rates of turnover for public health agencies, both local and state across the country, but we're not seeing that at Central District Health.
Madam Chair, this is Josie.
Yes, Josie, go ahead.
Thanks. Commissioner Lachiondo, I will also add that for our call center staff, we've actually seen what I would call the opposite of turnover. So we started hiring temporary staff to work in our call center in late July. Before that, we were using our internal customer service representatives, and before that, we were using the Medical Reserve Corps volunteers. since we have started hiring temporary staff to work in our call center, 3 of our call center operators have moved into other positions within our response. So I feel like that's a testament to how much they learn about what the public needs and wants to know about COVID, and that they feel like a good resource. So 2 of our call center managers actually have moved into investigator positions. So they're dealing with case investigations, and then 1 of our call center operators moved into our schools task force and is working with schools, and I think continuing to be a great and important resource, just in a different part of our response.
Thank you.
Further questions for Josie? Well, Josie, thank you so much for your presentation and your fine work, and we will proceed on with the agenda at this time. We will be talking with Laura Smith about health policy and promotion program updates. Laura, the floor is yours.
Thank you, Madam Chair, and thank you for inviting me back, Russ, and for having me aboard. I'm going to pull up my presentation here. Hopefully I can get this to work properly. Always something with technology, right?
Correct.
Okay, super. Okay, I hope everybody can see my slides. So again, thank you for having me this morning. I'm here to talk a little bit about what's happening beyond COVID. We have a really fantastic staff group working on COVID, and it's amazing how much they've been able to accomplish, but our other staff is also continuing to do the good work of Central District Health, and so I wanted to share a little bit about what the Health Policy and Promotion Program has been up to and give you some of their highlights. So in October, you all had me at your board meeting to give you an overview of the Valley County Opioid Response Project, or VCOR as we call it. So a quick update on what they've been up to there. In late October, just following the board meeting, the VCOR Consortium coordinated with McCall Police Department and Valley County Sheriff's Office for the National Drug Take Back Day. So totals collected in Valley County were 26 pounds in McCall and 1.5 pounds in Cascade. And there's been additional collections previous to that and since. So I'm really pleased to see that take back. That's really important to make sure that prescription drugs are not being misused. VCOR is also working on a Valley County specific resource list for prevention, treatment, and recovery strategies. That's in collaboration with our drug overdose prevention program, as well as a number of consortium members who have their own resources. And we look forward to making that available widely across Valley County. That will not just be McCall specific. I know there's always a concern about focusing on those bigger communities, but we are really trying to reach far and wide across Valley County. And then the ROC, which stands for the Recovery Oriented Community, is a new center that was established in McCall. It is close to St. Luke's is what my understanding is. I have yet to visit, but they have been providing peer-led support groups for substance use and opioid use disorder. They have a peer support network there and an administrator of that facility, and will continue to serve all of Valley County, but just really excited to see how quickly that's gotten off the ground. And shifting a little bit to district-wide, our drug overdose prevention program has been deep into trainings. Our coordinator has hosted 8 trainings for prevention and response. That covers a wide array of topics, but a general understanding of what opioids are, what signs and symptoms of overdose look like, and how to respond to those, including some education on naloxone. There have been 2 trainings for providers and healthcare staff. And through those presentations, organizations have received naloxone in partnership with Idaho Harm Reduction Project, which is a local nonprofit, and 8 organizations are now equipped with naloxone. So we're pleased to have reached over 100 people since September, and we have a lot on the books upcoming, including, as you can see, a little graphic for a Valley County specific training on January 21st. So Commissioner Hasbrook, I hope you'll share that far and wide. Commissioner Maupin is also aware of this. Our Partnerships for Success program, which is a grant that we received from the Idaho Office of Drug Policy to focus on substance use prevention, has been working with community partners and other CDH programs to distribute over 1,000 drug deactivation pouches and 163 prescription lock boxes in all 4 counties. And that, again, is just to ensure our communities are safe, so that if parents have prescriptions left over from a surgery, that they don't get into their kids' hands, that they don't get disposed of improperly, just making sure that they are taken away and done with at the proper time. Partnerships for Success has also been partnering with the Boys and Girls Club of Ada County to implement Positive Action. Positive Action is actually an Idaho-developed resource, which we're really excited about. It's an evidence-based social-emotional learning curriculum. And so Boys and Girls Club will be able to work with their students, and we have also been hosting trainings for other organizations. There is a family component as well as a general social component for that. And we have also been continuing to advance the Be the Parents campaign. That is a statewide campaign, and it is focused on diversionary activities for kids and introducing the conversation of how to be safe between kiddos and their parents, especially focused on underage drinking. And then this spring, we are excited to be hosting a series of 4 parent lunch and learn webinars focused on youth substance abuse, youth substance use and misuse. And so we look forward to sharing more about that in the future. And then the Western Idaho Community Health Collaborative, or WICHC as we call it, you may remember is a collaboration between Central and Southwest District Health and a number of private entities, both major hospital systems, St. Luke's and St. Alphonsus, United Way of Treasure Valley, Blue Cross of Idaho, Foundation for Health, and a number of other partners coming together to work towards social determinants of health, working upstream. And so the whole WICHC collaborative has identified 2 counties to be the focus for the get-go. And we are very pleased to say that we received the first ever Get Healthy Idaho grant from the Department of Health and Welfare for work in Elmore County. This $155,000 is for our phase 1 of work, and we look forward to even more with that. The program is still unfolding, but we anticipate being a part of phases 2, 3, and 4, and however that program evolves. But being the very first, excuse me, and being the only one is a really, really exciting feat for us. So that work will include qualitative assessment to understand mental health and diabetes and the high rates in Elmore County. And then we will begin implementation to address those areas of need by this coming fall. In Southwest District, Gem County is the focus. Their Community Health Action Team, or CHAT as they call it, is working towards plans there. And then in Caldwell, they are working on a transportation project. And then in both counties, there's work being done to develop a wellness fund. That fund would be to support additional work in those communities and to really respond to the needs of the communities as they see it. The Funding Council, who oversees the disbursement of the funds, shall I say, or at least the general guidance and strategies behind the funding, has received a training, on how to partner with community development financial institutions and community development corporations. Both of those are to address low-income, high-need communities, and so that training was paid for by the Federal Reserve Bank and hosted by Build Healthy Places. So some really great connections for us there. And then we are also collaborating with the Idaho Community Health Worker Association. And Fit and Fall Proof, as everybody may recall, is our senior fitness program and fall safety. And as you may expect, that high-risk population has kind of forced Fit and Fall Proof to take a step back. So at this point, we would normally have about 30 sites operational. Instead, we have 2 classes in very large facilities that are able to operate with masking, distancing, and less than 9 people total attending. So we're pleased to have those 2 programs operational and look forward to when it's safer for all of the others. But our coordinator is instead focusing on home safety checks. So with full COVID precautions, he is going in person or working with seniors via FaceTime to look for trip and fall hazards. So that might be a rug that could be slippery, a staircase without a railing, so forth and so on. And so providing recommendations there and also providing a free nightlight donated by Idaho Power. But I think probably one of the most important pieces of what Fit and Fall Proof is doing right now is reducing social isolation. Those classes were the place for many of our seniors to get together, to see their friends, to not be alone for a little while. And so not having that opportunity has been hard, but our coordinator has been working diligently to introduce phone trees and to leverage social media to reduce that. And so just a little aside, but a super important piece. And then our diabetes, heart disease, and stroke prevention program is working towards a series of community health screenings. We anticipate screening over, or at least 160 participants, I should say, for high-risk populations, looking at their blood pressure, body mass index, A1C levels, lipid panel, and then referring those individuals to healthy lifestyle change programs. This is a new undertaking for us, but has some really big benefits. We are going to be collaborating with other CDH programs like our tobacco cessation programs and external partners like Idaho Food Bank. We are working very diligently to make sure that this opportunity is available in all 4 CDH counties. And the overall goal there is to reduce barriers to care and empower active participation in their own health. And speaking of tobacco cessation, we were hosting a whole lot of those classes before COVID hit. But we have had to transition many of those in-person classes to virtual classes. So we are now equipped to host those tobacco cessation programs via Zoom. Our leaders have been all trained up. They have revised their curriculum as necessary, and we have been running an ad campaign to promote those classes. Uptake has not been as great as we would like it to be, but we'll keep pushing forward. And we're also excited with the new year to be able to introduce one youth class with West Data School District. And then we have also made recorded sessions available to the Juvenile Detention Center. And also very exciting for us in the tobacco cessation world is that we received the Community Health Innovation Fund grant from St. Luke's Elmore. So we will be training tobacco cessation instructors in Elmore County so that it will not be such a Boise-based program for those populations, but it will be their own, helping their own, and so we're really looking forward to that. And then just some brief highlights about a couple of other programs. Our suicide prevention program hosted Question, Persuade, Refer suicide prevention training for nearly 200 participants this summer and fall. They collaborated with the Region 4 Behavioral Health Board on that, and we'll be continuing to collaborate with a subcommittee of that group for the Region 4 Suicide Prevention Plan. The Behavioral Health Board itself will begin strategic planning in January. And then the Comprehensive Cancer Control Program is really focusing on clinical champions at this point. So at Terry Riley, physicians are providing medical lectures to other physicians, to their peers, on HPV-associated cancers and vaccinations. And they also launched a quarterly newsletter on behalf of CASPA. And so with that, I bring you to what I think is some of the most exciting news is what we have on the horizon. So we recently submitted a HRSA grant, the Health Resources and Services Administration, to Healthcare Services Outreach Program. This will be an Elmore County-based program to improve referral to primary care prevention and wellness resources, mental health resources, and other social needs. This would be a really innovative program for us. It would include kind of a meld of the community health worker model with the community schools model, and that would be in collaboration with Desert Sage, St. Luke's Elmore, and Mountain Home School District. So cross your fingers. We hope to hear about that by May. And then also we are working on a USDA Farm to School program grant. That would be in collaboration with Glens Ferry School. It would be a focus on agricultural and nutrition education and providing hands-on experiential learning through a greenhouse and gardens there. And then we are also crossing our fingers for Cascade Medical Center. They submitted an application to the HRSA Rural Health Network Development Planning Program. We would be a partner on that for their Healthy Aging Planning Network to expand access to care for seniors. And with that, I will take any questions.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Laura, first, thank you. A lot of work, a lot of important work. You know, it all gets overshadowed right now by COVID-19, but there's so much important things that you're doing with all these programs. What would you say is the biggest lesson learned from dealing and trying to keep momentum going for all the programs during the face of the pandemic?
Thank you for that question, Dr. Epperly. Madam Chairwoman?
Yes, go ahead, Laura.
I would say innovation and persistence. Those have been the two key words amongst my team. This group has been fantastically innovative in figuring out how to continue with their programs. We were very pleased to report with our Q4 reports to the state that we only missed one deliverable amongst all of our programs, and that was just because we couldn't host something in person. We have been continuing to accomplish what we set out to accomplish, and that is no small feat, but this group is just continuing with their mission and being innovative to make sure we get it done.
Really great work. Congratulations to you and the team.
Thank you. I'll pass that along.
Any further questions or discussions for Laura? Well, Laura, that's overwhelming, and congratulations on these efforts. So with that being said, we will move on to number 9 on our agenda, which is discussion and vote on our 2020 schedule for the remainder of December. Russ, would you weigh in on this, please?
Sure, Madam Chair. So we have 2 more meetings for the remainder of the calendar year. These were meetings that we set quite a while ago for the COVID discussions. One of those is next Tuesday, the 22nd, and then the final one for the year would be Tuesday, December 29th. So we have this to decide on, and then also next year's schedule, which is the next agenda item. What I would recommend is that we cancel next Tuesday's meeting. We've had a lot of meetings in the last couple of weeks, but leave the December 29th meeting on the schedule. And if there's no interest in having that meeting, we can always cancel it. But I just think we ought to leave it on the schedule because a lot can change in the next couple of weeks as far as COVID, and that is the intention of those meetings.
Okay, thank you, Russ. Thoughts from the board?
Madam Chair, for a motion?
Yes, Megan, go ahead.
Yeah, I would make a motion to maintain the December 29 meeting, but to cancel the December 22 meeting based upon the recommendation of the director.
Okay,
Chair,
thank you.
this is Jane. This is a second.
Okay, thank you. Is there further discussion before I call for a vote on the motion? Okay, Boise County.
Aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. All right, and then we will be discussing and voting on our 2021 regular business meeting schedule and the COVID schedule. Russ, would you like to weigh in again, please?
Sure, Madam Chair. So we developed the schedule for 2021. As you all know, this is the board meeting where we set the next calendar year's meeting schedule. So what we put together was the usual 7 meetings per year. We typically do not meet in January. I am going to recommend that we have a meeting in January and just keep that consistent with the other meetings throughout the year, which is the 3rd Friday. It would just be like today where we start our meetings at 8:30. So You all have a copy of that schedule. It's again, the third Friday starting at 8:30, January, February, March, April, May, August, October, and December. And the thing I wanted to add is that this board has the opportunity to call a special meeting at any time. And obviously we're in frequent contact. So if there is a need to have more frequent meetings at the start of the year or throughout the spring, then we can always add those to the schedule. So this is the schedule I recommend for 2021.
Okay, thank you, Russ. Questions, discussion regarding the 2021 proposed schedule? Hearing none, I would ask for, yes, Megan.
I'm here for you. I'm going to make a motion if you're ready.
I'm ready.
All right, I make a motion that we accept the schedule as presented by the director.
Okay, thank you. Is there a second?
This is Jane. This is a second, and that will include January 15th. Okay.
Yes. Okay, thank you, Jane. Okay, any further discussions before I call for a vote? Okay, hearing none, we'll start with Boise County.
Commissioner Sturm, aye.
Okay, thank you, Ryan. Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Laciando, aye.
And Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. That meeting schedule stands approved as presented. Moving on, Russ, to your district director's report. The floor is yours.
Yes, thank you, Madam Chair. So I just wanted to give just a real quick update on what we're seeing with the COVID cases. So the numbers remain quite high, although they've definitely leveled off for most of our counties. So that's really good to see. I know there's a tremendous effort going on throughout our health district, including our rural counties, as was reported out at Tuesday's meeting. People are wearing face coverings and physically distancing, and it's nice to see that we're getting some results from all of that. You know, in public health, we do serve individual patients through our medical clinic, but it's really about trying to help the entire community be as well as we can be. So I realize coming up ahead is Christmas and New Year's holiday. It's a time for gatherings and get-togethers, and I would ask our communities to continue to do what you're doing. I know there's some personal sacrifices having to be made with not spending as much time with families, or certainly extended families and parties and get-togethers, but it's really crucial right now that we get through the next couple of weeks. The vaccine supply, as you heard earlier in the agenda, is on its way. Hopefully that will continue to ramp up, so those who choose to get vaccinated will have that opportunity to do so, and we can move on into the spring in a good position. We're seeing a lot of people continuing to die from COVID. It's just kind of this weird place to be in, where we're seeing all the positive news about vaccine, and then on the national news, you see record numbers of people dying and record numbers of cases. So we're far from out of the woods. Just again, I really want to thank our communities for doing the things that we've been asking them to do for months, and I think the light is a lot closer to be seen at the end of the tunnel. And again, just stay safe during the holidays. I do not have anything else that I need to share. I would open the floor up for the board at this time to ask me any questions that for any topic that we didn't cover today on the agenda.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Russ, we know from Kim Link's presentation that they were having problems getting all the data in. We were running maybe even 1 to 2 weeks behind. 2 questions. How are we doing with timeliness of data? And because of that, are we overstating, understating, or do you think accurately stating the situation in our 4-county area?
Madam Chair?
Yes, Russ, go ahead.
Yeah, that's a great question. So she knows, Kim and her team, they see the cases coming in. They can estimate before all those are entered into the system, what it's likely looking like from week to week. So the data that we publish on our website, the most recent week or two, which is clearly noted, is not going to be fully built out. But from what she is sharing with me, we're quite confident that we're seeing, I would call it more of a plateau, maybe a slight downward trend for most of our counties. Boise County, we're starting to see, I would say it's more of a continual trend upward. But for the most part, it has leveled off and slight downward trend. But, when we talk about a downward trend, when you're 2,500, 2,700 cases per week, it's still far from being in a good situation or a comfortable situation.
Okay, thank you, Russ. Any further discussion items or questions for Russ? Concerns of the board? One thing I would like to clarify with the board is if we go ahead and our December 29th meeting, time for that. Russ, would you like to weigh in on your preference?
Sure, Madam Chair. I think that the 3:30 time worked well for us, and as we know, we had a request from law enforcement to move it up just so we could keep our community safe and our staff safe and get the board meeting started and ended during daylight hours. So that would be my recommendation, is we do it at 3:30.
Okay, thank you. I don't think we need a motion for that. So is there any conflicts with board members in that time frame? Okay, hearing none, we will plan on 3:30 for the 29th. I guess we're ready for a motion for adjournment.
Madam Chair, this is Diana.
Yes, Diana.
Thank you. Before we take that up, this is likely to be my last sort of full board meeting. Certainly we'll have more COVID-focused meetings coming up, but really appreciate the opportunity to be a part of this board. Certainly not what I expected when I signed on, not what any of us expected for this year, but it's been an honor to be on the team, and I thank you for the graciousness that we've all worked through during this year, and just appreciate all of you and wish you all the best of luck. So I know we'll be seeing each other over the next few weeks, but just wanted to make that statement.
Madam Chair,
this is Ted.
Yes, Ted, go ahead.
Diana, I just want to say thanks to you too. It takes all of us to make decisions, and all of us are smarter than any of us. So I really appreciate your commitment, your loyalty to the community, everything that you've done to push things forward. Best of health to you and your family, but I just want to personally thank you on behalf of the medical community in terms of everything you've done to help move health forward in our 4-county area. Thank you, Diana.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, I just wanted to also give my thanks to Commissioner Lasciando for all of her efforts. I know how it started out, where we were talking about septic systems and foodborne illness and general things that the public has very, very little interest in, even though all the work that we do that's kind of in the background is of great benefit. And then the pandemic hit, and I just appreciate all your patience, certainly with me. I know you've had a lot of questions, a lot of input, and hopefully our agency was able to respond to that timely and effectively. And I just appreciate your leadership and being part of the board during this clearly the most challenging time we've ever faced. So thank you.
I think we'd all rather have a little E. coli right now, given what we've been dealing with. Here we are.
All right. Okay, well, as Chair Diana, and on behalf of the board, I would certainly echo Ted and Russ's comments for your participation, and wish you joy and happiness and success in your future. So with that being said, we will, let's see, did we have a motion yet? Did anybody step up? Yeah. Okay,
This
go ahead,
is
Megan.
Representative Blanksma for a motion.
Okay, thank you, Megan.
Sure.
Second. We have a second for the motion.
This is Jane. I'll second.
Okay, thank you, Jane. Okay, no further discussion before we call for a vote. I'm hearing none. I will call for a vote from Boise County.
Commissioner Sturm, aye.
Valley County.
Thank you, Diana, for all your hard work. My vote is yes.
Okay, thank you. Ada County.
Jane Young, aye.
Ted Epperly, aye.
Diana.
Commissioner Lachando, aye.
Okay, and Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. Motion does pass. Our meeting stands adjourned, and with that, I would certainly like to wish everybody in the public that's listening in a very blessed and safe, merry holiday season for all. And as stated, we will be meeting as scheduled now on the 29th at 3:30 in the afternoon. Have a good day, everybody, and goodbye.
Stay well, all.
Merry Christmas.